Thanks for joining us to learn a little bit about diabetic shoes and getting insurance to cover them. For a bit of historical context, the Congressional Shoe Bill was signed off by Ronald Reagan way back in the 1980s as a preventative measure to reduce the amount of health issues that diabetics were having with their feet. That's because with increased prevalence of neuropathy and the loss of proprioception, which is basically your awareness of the position and movement of the body, there is a greater chance of getting calluses and ulcers from ill-fitting shoes, which can quickly lead to infections if not treated properly. And infections can unfortunately get into the bone, which will often necessitate an amputation. So in short, it's extremely important to take care of your feet, even if you can't feel anything down there. Fortunately, Medicare provides coverage for shoes and orthotics for people with diabetes who qualify under Medicare Part B. So what makes a diabetic shoe different from a normal retail shoe? Well, here are some general guidelines that shoe manufacturers need to consider when making shoes that get approved for diabetic care. 1. They need to have a tie or strap closure, so no easy slip-on shoes or slippers make the cut. 2. They need to have an added ankle collar and protective toe box, which will get the shoes on and protect sensitive toes. 3. They need to have extra depth, which typically means the liner that comes with the shoe can be removed so that a custom orthotic can be put in instead. 4. They need to have durable shanks, which prevent the shoe from flexing in the midpoint. 5. They need to have minimal stitching on the interior. And 6. They need to have a sturdy heel counter, which helps reduce ankle rotation. How individuals qualify. First of all, we need to get your primary physician involved, which means the MD or DO treating the patient for diabetes must certify that the individual, 1, has diabetes, 2, has one or more of the following conditions in one or both feet: history of partial or complete foot amputation, history of previous foot ulceration, history of pre-ulcerative callus, nerve damage because of diabetes with signs of problems with calluses, poor circulation, or foot deformity. 3. Is being treated under a comprehensive diabetes care plan and needs therapeutic shoes and/or inserts because of diabetes. If an individual qualifies, he or she is limited to one of the following footwear categories within 1 calendar year: either 1 pair of depth inlay shoes and 3 pairs of inserts, or 1 pair of custom molded shoes including inserts and 2 additional pairs of inserts. Separate inserts may be covered under certain criteria. Shoe modification is covered as a substitute for an insert, and a custom molded shoe is covered when the individual has a foot deformity that cannot be accommodated by a depth shoe. Meeting Medicare requirements. In order to receive payment for therapeutic shoes and inserts, Medicare also requires a podiatrist or other qualified doctor to prescribe the shoes, or a doctor or other qualified professional, such as a podorthist, provide the shoes. We offer the widest variety of diabetic-approved footwear in Colorado, and we'd be happy to show you how to get a pair of shoes that meet your needs. Give us a call to make an appointment, and we will work with your doctor to fit you in shoes that will make you look good, but more importantly, make you feel good. So stop on by and get fitted the right way.